This is the case of primary pulmonary artery hypertension. History wise, 21-year-old person having shortness of breath only for last 6 months, and main history, the main shortness of breath is only for 15 days. You can see the right atrium, this is right atrium, right ventricle severely dilated. This is left atrium and left ventricle relatively small in size. Main pulmonary artery and branches are also dilated. This is right ventricular outlet, this is pulmonary valve and main pulmonary artery, this is right pulmonary artery, this is left pulmonary artery. Severely dilated. Again see the same thing, you see the contrast formation within right atrium and right ventricle also, because the velocity of blood within right atrium, right ventricle is low, so low velocity or low velocity you say. You see the severe TR, you see the IVC dilated compared to right atrium, IVC dilated compared to aorta. This is IVC and this is aorta. So IVC dilated to aorta, you see the size of aorta simultaneously with IVC. IVC is almost twice the size of aorta. So IVC dilated. You can see hepatic vein also had flow reversal, that is red in color. Again the main pulmonary artery dilated. You see the D-shaped left ventricle, and D-shape is almost maintained throughout the cardiac cycle, that is both during systole and diastole. That means pressure overload of right ventricle. You can clearly see D-shaped left ventricle. This left ventricle is D-shaped. This is D-shape, just imagine this is D-shape. LV has got D-shape. So whenever you see D-shaped left ventricle, almost during systole and diastole, that means right ventricle pressure overload, but only during diastole, not during systole, then that will be volume overload. Mostly what happens, volume overload, initially volume overload, finally pressure overload, because pulmonary artery system gets damaged due to long existence of the disease. Finally the pressure overload happens, pulmonary artery pressure rises, and finally significant or severe pulmonary artery hypertension develops, and that is called right ventricle pressure overload. In this case we get right ventricle pressure overload. Everything happened over the 6 months of duration. The patient is only 21-year-old. On X-ray there is significant cardiomegaly, but pulmonary parenchyma, pulmonary zones all are normal, pulmonary artery enlarged. So ultimately this case comes towards primary pulmonary artery hypertension. So this is the case of primary pulmonary artery hypertension. Thank you.